Now, from ABC4 News, coronavirus preparation versus panic.
This does not mean that the pandemic is over. This is just a step in the direction of recovery, and it's a good step, but it's just a small step. We will continue to monitor the data. Data is what is driving us. It's not fear. It's not politics.
Governor Gary Herbert in a press conference where he announced the return of elective medical procedures, which the state had postponed due to the pandemic. Thank you so much for joining us. I'm Glenn Mills with the return of elective surgeries to Utah hospitals. What does that mean for patients who may have been putting off medical care? We're joined now by Dr. Vamsi Yaganti. He's a cardiologist at St. Mark's Hospital Heart Center. Dr. Yaganti, studies have shown that people are staying home with emergent health care needs in light of concerns around COVID-19 at hospitals. So first of all, what do we mean when we say emergent health care needs?
So as far as cardiology goes, emergent healthcare needs can include diagnosis of having heart attack, congestive heart failure, having rhythm issues. These are the three broad categories from cardiology perspective.
So even with the return of elective surgeries or procedures now and lifting of some restrictions, do you find that people are still wary about coming into the hospital given all that's going on?
Absolutely. I think that's an important message that we need to give to the community, is that coming to the hospitals is safe. We are taking all precautions to keep both the patient and healthcare personnel safe. And the downside of not coming to the hospital with anything which qualifies as cardiac emergency is much higher than the COVID infection, itself.
Yeah, that makes sense, but still people are fearful. So what is your advice to them to help them get over that so that they can get into the hospital and get the help that they need?
So there are two aspects of, cardiac care. Now, the first aspect of is the emergent care that you have, alluded to. 1 in 4 deaths in America are still with cardiovascular disease, and that's many-fold than COVID infection. So if you have symptoms of heart attack, if you have symptoms of congestive heart failure, or if you're feeling palpitations, please don't hesitate to seek immediate care. Some of these conditions are very time critical. A patient who comes to the hospital within 4 hours of having chest pain has much better outcome than a patient, who stays 4 days at home. The second aspect is the ongoing care of chronic heart conditions. We have multiple options available where we are doing telephone encounters, we are doing telehealth encounters to, get care to the patients while they are still at the comfort and safety of their homes. So I encourage patients to, use that option and not hesitate to seek care when if they feel that there is anything emergent.
Okay, the American Heart Association reporting decreasing numbers of heart attacks and strokes showing up at hospitals during this pandemic. That doesn't mean there was a decrease in those events actually happening, right?
No, that's a very good question that you ask. Data out of Italy says that, they have noticed 80% decrease in the number of heart attacks that presented to the hospital. And today there was an article in NEJM. It said that the number of cardiac arrests in Italy went up by 55%. So unfortunately, because of the fear of coming to the hospital, patients are staying home and having, bad outcomes. My fear as a cardiologist when, all this is said and done is that the death toll from non-COVID causes is going to far outnumber the COVID-related deaths.
Yeah, I mean, you bring up that statistic, and that's pretty scary. That many people are having those types and not getting help.
Yeah, and I think one of the important things, and this conversation that we are having today is that, assuring the patients that it is safe to come, in coming to the hospital, and that both hospitals and healthcare professionals are taking every precaution in trying to keep our patients safe.
Got it. So elective procedures back on the table. What does that mean specifically for patients?
So from the patient's perspective, at St. Mark's Hospital, we are doing COVID tests on all our patients. That is an important step in making sure that the healthcare professionals who are caring for those patients, are safe. We have also made some changes to certain procedures as far as the duration of the stay goes, not, keeping the patients overnight, doing some same-day discharges, trying to minimize the exposure of these patients to, potential COVID patients. What I would encourage patients to do is to talk to their cardiologist and, discuss their symptoms and come up with a plan that they're comfortable with in, getting those elective procedures done.
Yeah. All right. Dr. Vamsi Yaganti, cardiologist with St. Mark's. Thank you so much for your time and information. Very important tonight. Thank you.
Okay. Thank you.
Still ahead, how emergency departments are taking extra precautions to keep patients safe during the pandemic. That's coming up next.
You're watching Coronavirus Preparation versus Panic.
Welcome back. As we've heard, some patients who need emergency health care might be afraid to seek it in light of the pandemic. But hospital emergency departments are taking special precautions to make sure to keep patients safe. Here to talk more about that is Dr. Jeremy Voros, an ER physician at St. Mark's Hospital. Dr. Voros, great to have you with us. We already discussed a little bit about the emergent health care needs with Dr. Yaganti, but for you, are you as concerned as he is that patients with emergent needs are just waiting to come into the hospital, or even worse, not even coming in at all?
Yeah, absolutely, Glenn, we are. Dr. Yaganti is one of our expert cardiologists at the hospital. We have the same concern among our general surgeons about patients with appendicitis or bowel obstructions. Our neurologists are wondering what has happened to the volume of stroke patients that we usually see in the emergency department. So absolutely, anecdotally, I mean, it's a little early to have hard numbers, but anecdotally, yeah, we all seem to feel like there's been a drop in those emergency type conditions that we're used to seeing on a daily basis.
And I'll pose the same question to you as I did to him. Obviously, it's very unlikely that those things are still happening, right?
Yeah, absolutely. I mean, I don't think that staying home has suddenly decreased patients' heart attack risk or stroke risk that much. So yeah, absolutely, we're still very concerned about that.
Okay. As St. Mark's is now moving forward with scheduled procedures, what precautions are you taking in your department to ensure patients are safe?
That's a wonderful question. It's not as inviting as it used to be. I mean, we have the disaster tent that the state provided out in front of our hospital. We're doing screening of patients as they come through. They get asked a few questions about respiratory symptoms. They get their temperature taken. They get a mask put on them. So every patient coming into our department is wearing a mask for their safety as well as the safety of the people and other patients around them. In the department, we're segregating patients based on their symptoms. So if a patient seems like they may have a respiratory illness or other symptoms that suggest a COVID infection, they're going to a designated treatment area in the department. Patients with routine complaints, musculoskeletal injuries, twisted ankles, chest pain, abdominal pain, they're going to the usual treatment spaces in the emergency department.
Some of that, what you talked about, obviously in response to the pandemic, but how do those protocols that you just mentioned compare to before the pandemic versus what you're doing now?
It's a pretty significant difference. I mean, before in the emergency department, we'd allow patients in with 2 or 3 or even 4 visitors, family members who'd accompany them in. Currently now, we're allowing only 1 or even no visitors in certain circumstances. So the department is a lot more quiet and a lot more calm in a way that it wasn't before, but you know, in a slightly uneasy way because of those changes. So that's a big change. The pre-screening is a big change. The segregated areas in the department obviously is a big change in our typical workflow. But it's slowly becoming the new normal.
Yeah, let's build on that a little more, the new normal, because we're starting to experience that in all aspects of life. But what else should someone know before coming to the hospital? You've already talked about limiting guests, but what about masks? We're all wearing masks now. Does someone need to come into the hospital wearing a mask? And what other things that are associated with the new norm do we need to know about coming to the hospital?
Yeah, I mean, you can see that I've got my mask on. I would encourage people to be wearing a mask anytime they're out in public and visiting any kind of public place in general. So, yeah, absolutely. If you're going to go to the hospital, I would recommend that you wear a mask. That should not be an obstacle to seeking medical care. Obviously, we have masks to provide patients when they arrive if they don't have one of their own. So, yeah, I mean, that's a big difference.
Yeah, so we're used to seeing you, the doctor, wear the mask, right? Now we need to get used to seeing the patient wearing that as well. Anything else that you would want patients to know that I didn't touch base on?
No, I just really appreciate you bringing light to this. We're working very hard at the hospital to make sure things remain safe for patients so they're not obstacles to them seeking care for other conditions. We don't want people to delay that, so I want them to know that we're working hard for their protection and, I mean, quite honestly, our protection as well. We want to work in a safe environment and limit our risk of exposure to the disease as well. And I think that this is probably going to be the situation for the foreseeable future.
Yeah, I'm really glad you brought that point up, that you are putting your life on the line to help out in any way you can in this situation, you and your colleagues, and we really appreciate the work that you're doing in that arena.
Thanks, Glenn.
Real quick before we let you go, what's the best way to learn more about St. Mark's?
Go to the hospital, stmarkshospital.com.
Okay, and then we have that information and even the phone number for you right there. Appreciate your time. Thanks so much for joining us.
Happy to be here.
Still ahead, the state of Utah has doubled down on its contact tracing efforts. And just like everything, there's an app for that. We'll get into that next.
You're watching Coronavirus Preparation versus Panic.
It is the process of tracking down anyone who might have been infected by a person who was recently diagnosed with COVID-19. Contact tracing make that, helps identify those people so they can quarantine themselves and prevent further spread. The Salt Lake County Health Department has received national recognition for its COVID-19 contact tracing efforts.
The faster we can contact these people and educate them to either isolate or quarantine, that's going to help decrease the spread of this infection.
The Salt Lake County Health Department believes they have been able to find the source of infection in about 85% of the cases. Originally, the goal was to call for anyone who had come into contact with COVID-19 patient within the last 48 hours. Now, the state is doubling down on those contact tracing efforts.
Up until this point, we have been identifying any close contact 2 days prior to symptom onset for a confirmed case. And now we're going to be extending that to go 7 days backwards. This is going to allow us to identify more individuals with a likelihood of having COVID-19, test them for COVID-19, and recommend isolation if necessary.
While contact tracers use a variety of methods to track down those who may have come in contact with a person infected with COVID-19, Utah and many other states are using a mobile app to help. The state has the Healthy Together app. In the last couple weeks, tens of thousands of Utahns have downloaded that app. That app allows you to check symptoms and find testing sites near you. It will also track your location through GPS and Bluetooth. If you do test positive for COVID-19, it allows public health officials to see where you've been and the people you've been around, as long as they too have the app. The app is available in the App Store and on Google Play. To help stop the spread of COVID-19, the Office of the Governor is pleading with everyone to wear masks in public. And the state is now offering free masks to all Utahns while supplies last. It's part of a new program called A Mask for Every Utahn. Utah-based companies like Cotopaxi are jumping on board to help make the masks. State leaders say the disease is spread through droplets, and wearing a mask can reduce the chance of spreading COVID-19.
Please, 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 we're asking you to help each other out. We know it's an inconvenience. We know it's not fun, but knowing that this little thing right here can prevent us from doing what we've had to do the last 5 or 6 weeks will help us grow our economy, will help us get people back to work and save lives. It's worth it for all of us to do it.
You can go to coronavirus.utah.gov/masks to get your own mask. A fair warning, though, the state has 2 million free masks to give away, but once they're gone, they're gone. Wearing a mask in public and social distancing are just some of the things that we can do to help stop the spread of coronavirus, even when we head into the great outdoors. Washington County State Park officials say that parks have been so overcrowded, they are now adding some new restrictions to ensure social distancing. ABC4's Katie Krellis reports.
Across Utah, state parks were packed this weekend, but especially here in southwest Utah. And now park managers here in Washington County will be making some changes. For the first time, rangers had to temporarily close the gates at Sand Hollow, Gunlock, and Quail Creek state parks because of overcrowding, a huge concern to public health amid the COVID-19 pandemic.
It was just too much for the park to handle. We filled all of our parking stalls, all of our camping areas were full. We don't want to see big barbecues. We don't want to see people dancing and getting together playing volleyball.
Sand Hollow State Park Manager Jonathan Hunt says he really wants visitors to come and enjoy the parks, but he says he expects that people will recreate responsibly and do their part to keep each other safe. He says he saw a line of parked cars stretching at least a mile down the roads over the weekend. Law enforcement say they will now be patrolling the roads and continue to break up large gatherings.
We will not be allowing people to park on the shoulder of the road. We will not be allowing people to park and hop fences and walk into the park.
Park rangers at Sand Hollow will now be limiting overnight camping at the beach. Now that 3-mile stretch of sand will allow day-use crowds to spread out and keep their social distance. Staff say this restriction will likely last for a month or two. Moving forward, when Washington County state parks reach capacity, typically between 10 a.m. to noon on weekends, park officials say no one will be allowed in for the rest of the afternoon.
Hop on our website, check our conditions before you show up to the park. Visit your local recreation areas and enjoy what Utah has to offer.
Katie Krellis, ABC4 News.
With the massive impact of COVID-19, we visited the Salt Lake County Health Department for the proper and effective way to wash your hands.
So I'm going to contaminate myself. So start by wetting your hands, getting them soaked, and you want to lather first, palms together. And you do the backs of your hands, and then interlace your fingers with palms together to get between your fingernails, or between your fingers. And then you clasp your hands like this and rub back and forth, and that kind of gets the backs of your fingers as well as your fingernails. And do the other side. And you want to make sure you get your thumbs. It's kind of a circular motion around your thumbs, other thumb. And then the palms of your hands, you do the fingertips around the palm in a circular motion. Get your fingertips nice and clean. And the other hand. And then my wrists. And that was 7 different steps. And if you do those 7 different steps for about 3 seconds each, you're going to get your 20 seconds of wash. And then I rinse it off and use my paper towel. Just the basic things of keeping yourself healthy. And those are the ways that you can help reduce your risk of getting sick and risk of passing on illnesses to others.
Curtis Booker, ABC4.com.
You're watching Coronavirus Preparation versus Panic.
Public health labs play a vital role in COVID-19 testing, from identifying positive cases to helping contact tracing, identifying hotspots, and much more. ABC4's Brittany Johnson shows us how one Utah lab worked around the clock to turn their lab into a coronavirus testing center.
Utah labs are working to slow the spread of COVID-19. Bert Lopansry, the Associate Medical Director for Infectious Diseases at Intermountain Medical Center, gives us insight.
One of the most important parts of any type of lab response is trying to identify those who are infected with the virus so that our public health officials can do effective case identification and contact tracing with efforts to mitigate transmission in the community.
Intermountain received clearance the last week of February to start doing coronavirus testing.
From day one, when we started testing in our lab, we were immediately faced with numerous supply constraints.
To meet testing needs and make sure enough materials were on hand, Tara Hall, the molecular pathology supervisor, says Intermountain revamped its lab, which allowed them to go from doing a couple hundred COVID-19 tests a day to now testing between 2,000 and 3,000 a day.
We're able to get really close to a 24-hour turnaround time from the time the sample comes to my lab.
Hall and Lopansry say Intermountain's labs are working to meet the needs of patients who need diagnostic testing by making testing more available to people wherever they live, partnering closely with the Public Health Department on testing criteria, and making sure testing sites are adequately staffed to meet the needs of patients. Reporting in Murray, I'm Brittany Johnson, ABC4 News.
Utah's first COVID-19 patient to receive a new treatment for the virus is now home with her family. 24-year-old Cynthia Lemus received a convalescent plasma transfusion after testing positive for COVID-19. Doctors say they used the plasma donation from someone who recovered from the virus, then transfuse it into a patient who is still sick. Now, according to Dr. Brandon Webb of Intermountain Healthcare, the body then generates an immune response which creates more antibodies. The theory is the antibodies then attach to the virus particles and helps neutralize them.
My heart dropped. It was like she was walking down the aisle again. Tears were coming out. It was just amazing. It was a surreal experience just because, for such a long period of time, we didn't know what was going to happen.
Doctors say although there is no evidence the treatment works to cure someone with COVID-19, it is part of a clinical study happening all around the country. If you have tested positive for COVID-19 but have not had any symptoms for 28 days, you could be eligible to donate. That does it for us tonight on this special edition of ABC4 News, Coronavirus Preparation versus Panic. As we learn more, you can count on us to bring you the very latest on this pandemic. We will see you back here tonight at 10. Have a good night.